Hi, this is Tim from ChiroUp, and today we're going to go over another Defining Moments video. This is an important one. This is a report of findings, a time when you have the opportunity to connect with the patient, let them know that you know what's going on, and more importantly, that you can help them. Let's go watch an example. Hi Debbie, nice to see you again. I did sit down and look everything over from what we had talked about, the exam findings and the x-rays, and I'd like to explain what I know, but more importantly, what can we do in order to help your problem. As the source of the problem, there's a couple of things combining to create your discomfort. Number one, there's been some straining of tissue in your lower back, and that straining is much like a rope that's been pulled too hard and it begins to fray. That allows joints to shift and move around. It causes a lot of inflammation, and it's complicated by a second problem. You have a joint in your spine that's not moving the way that it should. Normally, each joint in your spine moves freely and independently, and as I feel down your spine, it should feel like a big spring where everything flexes and bends. Most of your segments do work, but the very lowest segment's not moving the way that it should, and that lack of motion is setting up a cycle of discomfort. First, it's stiff, it's not moving, and it's like a rusty hinge. That means it requires more effort. So that muscle tightens, and as it tightens, it compresses that joint into its already stuck position. Well, the longer that's there, the more discomfort you get, and the more irritation you get to that strained tissue. The good news is there's something that we can do to help this, and what we would do is first use some therapy to help relax the muscles. I'll follow that by gently stretching the area and, most importantly, manipulating the joint that's stuck back into a freely movable position. I'll also give you some home exercises to help keep things in check once we get them there. Now, as far as how long this would take, it's not something that's going to go away overnight, but it won't take an extended period either. What works best is to treat it aggressively, get rid of it as quick as we can, and then put you on your own with the home program. By aggressively, I don't mean daily. We don't have to go that aggressively, but if you do elect care, I'd see it 3 times the first week and 3 times the second. By that point, you should be feeling at least 50% better, hopefully more, and then we'll cut our care plan back accordingly. As far as the cost of the care, your insurance copay is going to be $20 per visit. That's what's wrong, what I can do to help solve the problem, how long I think it would take, and the cost of care. Did you have any questions in addition to that?
No.
Great. Well, let's go next door. We'll go into therapy. We'll put the modalities on, and from there we'll go into treatment and get this turned around. And now my favorite part of the report of findings. That's handing the patient the ChiroUp condition report. A report that answers their questions and reinforces what we talked about. It provides implied credibility that now what we've said is in writing, and it gives them a tool to take this home to their families so that you can answer their questions and increase their compliance. Here's how I incorporate the reports in my office. Well, Debbie, I hope that answers your questions, but I'm sure you'll have more when you get home, and maybe your spouse and family will too. So I've put this information together into a report that answers your questions about what's wrong, what we can do to help, as well as the things that I'd like you to do at home. The other thing that's in the report are your exercises, and there's a link in the email that you'll have received that'll take you to video demonstrations of those exercises. So when we go back into therapy, you can take a look at this, and if you have any questions, make sure you ask them. So that's it. You've answered the 4 most important questions for that patient. What's wrong? How long is this going to take? What are you going to do to help me? And how much is it going to cost? That's your job as the doctor to relay that information. It doesn't matter if you do it on visit 1 or on visit 2. If the report of findings is on that day, that's when it needs to happen. Hope you've enjoyed that video, and if you visit ChiroUp, you can check out the other Defining Moments videos. Thanks for watching.